On a brand new episode of Ladies Digest, where issues in the world of women are discussed. As usual, I am your host, Joan Akua Iyoha, and this show is proudly brought to you by the AAU TV. Today, we have a very special guest in our midst who is here to digest this issue on maternal mortality. But before we do that, I'll read a statistics from the UN Interagency, which says that from year 2000 to year 2017, the global maternal mortality ratio declined by 38%. That's from 342 deaths to 211 deaths per 100,000 live births. Quite encouraging, right? But I think there's more that can be done. So after this time out, we'll get to meet our guest. Don't go nowhere.
Are you an institution or individual? Do you intend to organize a memorable event to be archived for future reference? Then look no further than AAU Studios, because it's your best bet. With our spacious studio and state-of-the-art media equipment such as 4K Panasonic video cameras, KinoFlow lights, assorted microphones, live streaming machines, and others, you are sure to get the best of production. Visit us at Trinity Avenue, East Legon, adjacent the National Accreditation Board, or contact the AAU Studio via the following addresses: info@aau.org, AAUTV@aau.org, Ransford@aau.org. Alternatively, you can call us on 0244 185 998 or 0244 693 342.
Welcome back. As I said earlier on before the timeout, we are talking about maternal mortality. And please don't forget you can join the conversation on our social media platforms, on our Facebook and YouTube page at the Association of African Universities, and on our Twitter handle at AAU_TV, and our Instagram page, Lady Digest. Do join us and follow us so you get more on the issues. Welcome to our show.
Thank you.
Midwife Sally,
yes,
as you like.
Sally.
Yes. You like being called Midwife Sally.
Yeah.
Before we go deep into the conversation, what inspired you to add that midwife to your name?
Okay, so what inspired me is, midwives form the forefront of maternal health.
Yeah.
Yeah. So if you take midwives off, then maternal health, there's something lacking. Yes. Because midwives should be in the forefront, and once they are involved in the forefront, most of the maternal deaths can be reduced. But it looks like our voice have not actually been that head. Yes.
Yeah,
so bringing the midwife Sally and then making it a bit more professional, but then also trying to educate the public to know like what we do. And also sensitize women about maternal and child health. So that is what inspired me
to brand yourself.
Yes, Midwife Sally.
That's a good branding. It just gives you that form of identification.
Yeah.
So welcome to our show. Welcome to
you.
Ladies Digest, and we are happy to have you here on set.
Yes, thank you.
So we are talking maternal mortality today, and I'll give you the World Health Organization's definition of maternal mortality. It says maternal mortality, according to the World Health Organization, is the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and site of pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. So, per this definition, would you have, let's say, okay, because it's quite big, but would you have a layman's definition in case I come to you, I'm not that enlightened, I come to you, how would you be able to define maternal mortality for me in your own term?
Okay, so thank you.
Yeah.
The definition for maternal mortality to a layman would be when a woman dies during pregnancy or during childbirth,
Okay.
or postpartum after the woman has delivered safely,
Okay.
till 6 weeks. That is what may constitute the 42 days.
42 days.
You had in
Okay.
your
Okay.
write-up.
Okay.
So it's a woman during pregnancy. So during early pregnancy, so late pregnancy, to delivery, so the woman has finished delivering.
Delivery, which is the postpartum.
Yes, 6 weeks. So
6
postpartum,
weeks.
or 42 days.
Or 42 days
Yes,
after.
that is
So
what we call.
I see. So will there be a term for after the 6 weeks death that occurs after the 6 weeks?
Okay, so it's actually, it will not be considered
Okay, maternal mortality.
maternal, like per the definition that is standard.
Okay.
Yes,
Okay.
accepted globally.
Accepted.
42 days. Yes.
So that may just be a normal
it
death.
could actually be related to a problem or a complication.
Okay.
Yes.
Okay.
But
Okay.
when
It
we are
won't be
per the
termed-
definition, it is
Yeah.
up to 42 days after
42
birth.
days. Okay.
Yes.
So if a death should occur after that, then it would just be a normal death. It won't be categorized into the maternal mortality. That's after the 42 days.
Yes.
Okay.
Yes.
All right. Okay. So yeah, it says accidental or incidental causes. Would you be able to explain
Okay.
the differences?
So what I would say is that when we talk about maternal mortality, we have direct causes and then we have indirect causes.
Okay.
Yes. So we are talking about direct causes are things that are actually related to the pregnancy, to the labor, to the delivery.
Okay.
So if a woman goes to give birth and then she bleeds, it's directly related to
the delivery.
the delivery.
Okay.
And then she had preeclampsia, is directly related. She had ectopic, it is directly related.
Okay.
She had an infection, maybe due to the birth or something, it is directly related.
Please, before you continue, what's the preeclampsia?
So preeclampsia is normally when a woman gets BP, her
Okay, the blood pressure increases. Okay.
Yes, with other symptoms like urine in protein,
Oh.
severe headache, and it has other conditions like you have chest pains, palpitations.
Yeah.
So it's a group of signs and symptoms,
Okay.
and we term it preeclampsia.
Okay.
So if you have any of them, like let's say headache, severe headache, that does not even go after resting
Imagine.
or taking any
medication or
yes.
something.
Or you have swollen hands and feet, you realize that your BP is increasing and you're having chest palpitations. Yeah, so you go to the hospital, they check protein and then you have 2+, 1+, then you are diagnosed as having preeclampsia.
Wow.
Yes, and it is one of the leading causes of maternal deaths
Wow.
in Africa, even in Ghana,
Wow,
as we speak.
it's that serious.
Very serious.
Wow.
Yes. It is
Wow.
actually one of the leading causes of maternal deaths in Africa. Yes.
Wow.
So we have top 5 causes of maternal death, and then we have bleeding, and we have preeclampsia. We have ectopic gestation, which actually happens during the first
trimester.
Yeah, first trimester. That's the leading cause of maternal mortality during early pregnancy.
Early pregnancy.
Yes.
I
Then
think that is when the fetus is, I think, outside the womb.
Yes. So
also.
in ectopic gestation, a baby, instead of being implanted in the right place within the uterus,
okay.
yes, can find itself in the fallopian tube or in the ovary,
Wow.
or in the cervix, and the baby cannot grow there.
Yeah,
Yes, so because there's no space, and let's say in the fallopian tube, it goes to a point it cannot sustain it, so it's bursts, and then there's bleeding, and it's really a serious complication. So that's the ectopic pregnancy.
Okay.
So those are the 5 top causes of maternal
So the
mortality.
bleeding, the preeclampsia, the ectopic pregnancy, infection.
Yes.
What are some of the infections that pregnant women are liable to contact during that their pregnancy?
So during pregnancy, our hormones, our bodies go through so many changes. Our hormonal changes and all that. It makes women become a bit more vulnerable during that time because your resistance to infection decreases. Yes. So if you are not eating well, if you are not really taking good care of your personal hygiene, and you are not doing what is expected of you as a pregnant woman, it makes you to easily contract any infection. So it could be a contributing factor. Then during birth, if let's say there's no skilled birth, there's no skilled delivery, or you do not deliver at the hospital, the birth is not a skilled birth.
Okay.
You need to be, you need sterile equipment for the delivery and all that.
Yeah.
But you go to deliver in a place where it is everything that is used is on sterile.
Sterile.
Yeah, so it can help. It can make you get an infection.
Yeah, infection.
Yes, that can cause you to die
Die,
within.
yeah,
yes, or
for
get
cause of
infected, get
maternal
sick,
mortality.
and then one of the leading causes. Of maternal.
Okay, so you
In the
mentioned
top 5.
the top 5. Okay,
Yes.
so you mentioned skilled birth. So would you say that the way our mothers were doing it then in the olden days, whether it's a midwife or an old woman who, by virtue of experience in delivery in number of women in the village, would you term that an unskilled birth? Maybe because those sterile instruments are not there?
Okay, so I would say, thank you for the question.
Yeah.
So generally I'm talking about traditional birth attendants.
Yeah.
Yes. So traditional birth attendants have been there. They have been there for quite a long time.
Okay.
And I cannot just sit here to discredit them.
Okay.
But then we are growing as a people.
Sure.
And as technology advances and societies grow, we learn new things. Yes, so we realize that many of the things that they are supposed to be used in doing delivery, when you are going to deliver, you need a sterile field.
Okay.
Sterile field means that everything that is going to be used to conduct the delivery should have gone through some kind of process, sterilization. Yes, where heat is used and other chemicals to use for every instrument that is going to be used, maybe to cut the cord, to clean you, and everything that is going to be used for you and the baby.
Yeah.
Because at that time, it's quite bloody.
Yeah.
They are going to cut the cord and all that. And it is a very good reception for infection.
Infection,
yes,
at that time.
At that time. So if you go to a traditional birth attendant who has not been trained and maybe just learned it, followed the mother or been watching somebody do it, so does not have any idea about the reason why she's doing this or doing that, but she just learned it. Yes.
Yeah.
So it means that is the risk that is involved.
Yes.
But I think for some time, the country was training traditional birth attendants to support, because when you go to the extreme parts of the country, you may not get a midwife or a medical personnel. So the people in the community trust them even more, and then they are available, they live with them, so they go to them. So they were training them. But it got to a point they realized that even with the training and all that, it was not reducing
the weight of the death still.
So I think that now more midwives are being trained, more cheap compounds are being brought up, midwives are being sent there, so that they can still provide skilled delivery and are very hygienic
in their traditional way.
Yes, even in the they are trying to do that to make sure that women get the quality.
That even if you don't go to the hospital or you don't give birth through the orthodox way, you can still get that quality care.
Yes, within your community. Yes, because if you have a midwife in a CHIPS compound because it's a CHIPS compound, and sometimes within the small communities, the midwife may know all the women, and they live close to each other. And the midwife can even attend to the woman right in her home.
In their own, in
her own home. By using the sterile equipment and the things that the woman needs to be safe. So that type of, the woman may not end up getting an infection. Neonatal sepsis is also another problem.
They were
neonatal, the baby can also end up getting an infection. So skilled delivery is very, very critical in reducing all these problems like the maternal mortality that we are talking about.
Well, that's true. So we know these things, it really depends on, it's not what one person can solve. And we know, what would be the rate of maternal mortality in a day that you know of?
in a day,
Yeah,
like within
yeah, maybe for your hospital or your outfits. How common is this maternal mortality?
Well, for a program like this, it wouldn't be like, but I think we can, it is actually happening.
Yeah,
and every minute, every second, as we sit here and we are talking, there's a woman somewhere who is losing her life due to maternal and maternal mortality. And the sad part of it is that more than 99% of these deaths are occurring in Africa.
More than 99%?
Yes, more than them, yes. Occurring in sub-Saharan Africa and Asia. Is it not Asia? Yes. So these things, it means that what is actually happening.
More than 99%.
Yes, it's actually of these deaths that occur globally. Occur in Africa.
Yeah, in Africa, and just maybe 1%.
1% or maybe 2% out there. Yeah, so the question is, what is happening? What are we doing? What are we doing
about
that? Is the reality of
the question.
Yes, for me, that is one of the things that made me to, okay, let me bring myself out there, because it's unacceptable that women should die. Yes, you are preparing for birth, you are bringing life into the world. You have 2 or 3 children already, and then you are going to bring another life, and then you go and you don't come back again.
Leave those ones behind.
Yes, and no one talks about it. We are behaving as if all is well.
It's normal to die.
No, yes, it is not normal. I mean, it's unacceptable.
Yeah, it's unacceptable.
Yes, just imagine parents are spending lots of money to educate their daughters, and then you're just going to give birth, and you don't come back again, and then we are not supposed to ask questions. We are not supposed to talk about it. We are supposed to behave as if everything
it's fine.
It's fine. It's not acceptable. Really yes, it is not fine. Yes, women dying, it's nothing fine. Yes, so we actually need to do a bit more.
So we'll go for a quick break, and when we return, we'll look at some of the things that government is doing, that government is doing to help reduce this maternal mortality. Hey, this is still Ladyz Digest on AAU TV, and we've been talking about maternal mortality, the causes of maternal mortality. We'll go for a quick break, and when we come back, we'll dive deeper into the topic. Welcome back, and remember, this is Ladyz Digest. Remember, you can join our conversation on our Facebook and YouTube pages, Association of African Universities. You can also drop your comments on our Twitter handle, AAU_TV, and follow our Instagram page at Lady Digest. And we're still talking about maternal mortality, and Midwife Sally has spoken really passionate about maternal mortality and why women should not die, that it is not acceptable. It shouldn't be the daily routine. It shouldn't be a normal thing that when we hear a woman dies because of one little thing and we say, oh, it's normal, it's one of those things, it shouldn't be acceptable. So we'll go back into the discussion. Welcome back, Midwife Sally.
Thank you.
Yeah, so you, before the timeout, you talked about, you gave the causes of this maternal mortality, 5 causes. So I would want to know what's the challenges and why are these deaths happening in the first place? Apart from the causes, the infection, Why is it very, very prominent here in Africa? You said 99%, more than 99%. Why Africa?
Yes, Africa because, okay, so we have actually categorized the causes of maternal mortality into three different categories.
Okay.
So, one, I would say delays from the
women.
From women,
Okay.
3 delays. So
Okay.
the delay from the woman,
Okay.
and or from us at home,
Okay.
and then the delay at the hospital.
Right.
Let's say, so we on this show we can talk about the delays that occurs with our women.
Okay.
Themselves.
Yeah.
Yes.
Yeah.
So I think that once we get pregnant, just as we prepare for other things.
Okay.
So you are going to have a wedding and you are happy and you are preparing for
Some
it.
prepare even a year before.
Yes, some prepare a year before.
Before.
And as much as it is important, pregnancy is even more important. Yes. And that is what we should realize as women, that pregnancy is even some young ladies will know nothing about pregnancy, will not prepare for it at all. Even, let's say, if they have a show that it's on pregnancy, I'm sure they'll tune into something else. Yes. But the sad truth is that you are a woman at a stage in life. If you want to have children, you are going to go through it.
Sure.
And the better you prepare for it, the better you go through it.
Yeah.
So if you actually think of having children once in your lifetime or in your lifetime, you should start preparing for it. Because things just don't happen.
Sure.
Just like you can't just decide not to prepare and then you write BEC or SSC or maybe your university exams.
Yeah,
no, it doesn't happen that way. You need to prepare for it.
Yeah.
You need to learn about pregnancy. You need to learn about labor. You need to learn about delivery. You should be concerned. I get sad when women call me and the person is telling me, I have very severe headache and I can do nothing. And then you ask this person, when was the last time you went to Ante-natal? And she tells you she went yesterday. Okay. And you are asking her, okay, so when they checked your BP, what was it? She has no idea.
I don't know.
Do you have your book with you? No, it's at the hospital.
What?
So you see that, no, it's like we are living our lives in the hands of just the health workers. But it doesn't, it shouldn't be. Like, you should
own it. You should know what's happening.
Yes, you should know what is happening.
So, for instance, if they give you an analysis, a health analysis, you should ask questions.
You should ask questions. Ask your midwife what is actually happening to me. Anytime you go for antenatal, make sure you know your BP, like the basic things, how your weight is going, how the baby, if they checked, you should know everything. But sometimes I have had patients who would alert you that, okay, I think this is going this way, and then you follow it up, and it is true. You investigate, and it is true.
Yeah.
So that person has helped you to help her.
That is
so if there was another woman who just maybe an oversight, I didn't think about it, and then she also thinks my midwife said, everything is fine. So I've had a woman who has followed me. No, she was always calling me and telling me, Auntie Midwife, I feel that my waters have broken.
Wow.
Anytime I go, the doctors say that I have an infection and they give me antibiotics. The midwife gives me an antibiotic. And this woman, I wasn't there. She was in Adam, in Accra, so she was just calling me on the phone. So I said, okay, then do well. And then she called me several times, believing that the treatment they were giving her was not the right one. So I told her, okay, then the next time you go, tell the doctor that you want to see a gynecologist, you want them to do a scan. And she said, okay, they would say I'm too known.
Imagine.
I said, no, it is your life. This is what you want.
Right. Yeah.
Because you don't believe that this is what is happening to you. It's actually what is happening to you. So she followed the advice, said she wanted to see a gynecologist. They let her see one. They took a scan, and lo and behold, water on baby was almost finished.
The water had really broken. Yes,
for a long time, and she was being treated for infection. So that was the woman helping
the helpers.
Yes, to help her.
Wow.
And that baby was saved. Yes. So she even showed me a picture of the baby when the baby was around 8 months, doing so well. But that baby would have died because once your waters break and then...
I think they said a day or two, you shouldn't...
You should report.
Yeah.
But this man was being treated
for
infection. So we shouldn't leave our lives in the hands of just health workers. And then once you are pregnant and you have, let's say, one of the danger signs, you realize that you've started bleeding, your waters have broken, you're having severe headache, you're having severe lower abdominal pain, all those things. You don't have to wait for too long. I mean, you should follow up, go and check, and then know exactly what is happening to you. But you don't wait for 3 days or 4 days. I've had an educated woman who didn't know that if she doesn't feel the baby move, she should. She thought
it's normal.
It's normal, yes. And this is not somebody who I would say is an illiterate. Yes.
She's enlightened.
So it cuts across although it may be higher and maybe those who may not have so much information. But even those of us in the university now, because we are not talking about it, people are not reading about it, people are not learning about it. And these issues are actually happening, not to just people who are not educated, but to
even the educated people.
It's actually happening to everyone. Yes, so we all need to be on alert. We need to read more about maternal pregnancy, labor, delivery. You actually need to know about it if we really want, as a country, to move forward and then reduce these numbers. We, the women, would also have to own it. And bring it forward.
Bring the agenda. Because the government can decide to set up something or set up a committee or put in some mechanisms in place to. But if we, the women, are not interested in it,
we are not
ready to own it, then I think it would just be better not even initiated at all.
At all. Yes. So we actually need women to talk about maternal and child health. Yes, we need to have like a campaign to say that no, our women are dying. We don't understand. It shouldn't be that way. It is highly unacceptable. Yes, it is highly unacceptable. For a woman who has come to the hospital with 3 children at home, 4 children at home, or even 1 child, or a man who has married like just a fresh marriage 1 year, and then she gives birth. Yes, it is sad. It is unacceptable. It is highly unacceptable. I mean,
does age play any role as a factor of maternal mortality? So in age, we are talking about either underage or overage. Maybe if a lady gets pregnant at the early age of, let's say, 15, 13, or like the elderly ones who maybe don't give birth early in the late 30s and 40s. Does this age play any role in maternal mortality?
I think that with that, what I would say is that what we have actually come to realize and also has been proven by research is that although we have incidents, like we say it is common among this group of people and all those things, it doesn't really always work. Because women who would have had, let's say, a normal pregnancy, no problem, and you categorize that person as a person within the safe zone.
Safe zone,
That you think that person is in a safe zone, and a woman who is 35 is not in a safe zone. But that 35-year-old woman, if she's doing everything right, is safe.
She's safer than
and then and it has been realized that complication is not a respecter of persons of whether doing pregnancy doing everything or not. So it's like at every point, doing pregnancy, doing labor, doing delivery, you should be cautious. I was a midwife, but hey, I was very cautious because it is not a respecter. You need to, I remember my baby came my last born, she really came a bit earlier
than expected.
We had clinics, hospitals, and along my path to where I wanted to give birth. But I bypassed them and I went because you should be able to choose a place where you are confident in. If I'm going to deliver, I have to make sure that the hospital I am choosing, it's up to the task, and I'm going to meet people I believe in, people are going to give me the care I need.
Yes, definitely.
A hospital that has
them,
a good referral system.
That's true.
That will not waste my time. I talk about delays by the woman. Delay can also occur in the facility. So if I am a woman and I'm pregnant, I've done everything right. That's what I was telling you about. I have done everything right, but I went to
the facility.
A facility, and they knew that they could not handle this, and they are keeping me for over 2 hours or 3 hours or 4 hours. And then when it comes to maternal and child mortality, every minute counts. Yes. So you should choose your facility. I mean, don't just go to any facility and think you should even investigate the people who are going to take care of you. Are they midwives? Are they doctors? Are they gynecologists? Are they qualified? Yes. Everybody has his own specialty. Yes. So you should investigate all that. I would make sure, if it is me, sometimes you may find yourself in a small community where it's just a polyclinic, but if I am in Accra, I want to deliver at a place where at least there would be ambulance for good they have a good referral system. There is blood in case I need blood, because you shouldn't compromise with your life. Yes, and you should also always go with a support person.
Okay. Yeah.
Especially nowadays, a lot of people are complaining about attitude of nurses, midwives, and all that.
They really complain.
If you go and then you have, let's say, you are going with somebody who is responsible, somebody who can speak for you when you
at
cannot.
That time, you are not in the right frame of mind to speak.
You are not the person is delaying. If the person who is your support person is passive and also just sitting there and not saying anything. But for someone who, the support person can say, oh, okay, my client is keeping that long. Can we actually do something? What is the next stage? What is the next step? And even the presence of the support person will let the health workers know that somebody is watching.
So you can't just play.
So it's a whole lot of things play when it comes to maternal mortality. But we can also play around it and also prevent maternal deaths, because most of the deaths that actually occur are preventable. They are preventable. Just last 2 weeks, one of my friends delivered. She had very severe preeclampsia. Yes. But I was with her from the beginning. She doesn't come to me in my hospital, but it was like a backup. I talk to her, I go through her book, we speak. So knowing how her BP is, she'll call me first even before she goes to the hospital. So when she got to around 6-7 months, I told her that the way your BP is, I don't think it will even be wise for you to wait that you want to get to 40 weeks or 38 weeks because of how the BP is. So, and then she was like, she wants to have normal delivery. And I told her it depends on the circumstances, but I had prepared her mind that she could end up having a CS or a normal delivery because of how her BP is going. Just 2 weeks after I talked to her, she had a severe headache, went to the hospital. She was having very severe preeclampsia, and they had to take that baby out immediately.
Wow.
But because I had talked to her, she just accepted it. She just accepted it. It was done. Baby was sent to NICU. Because the hospital, she chose a hospital that had a NICU.
It was a NICU.
NICU, a neonatal intensive care unit.
But
the baby will be
premature.
They send the baby there. She's fine. Baby is fine. And we are happy.
Wow.
Yes. So these things can actually be prevented when we put measures in place. Because she was prepared, but you know, we would still have a woman with that BP, and then we would tell her, okay, we need to send you to the theater, we need to save your life, we need to, and the person will be delaying decision making. There's another delay in decision making. The woman is telling you, I have to wait for my husband to
come before we.
I'm waiting because
it's not yet
she
time.
hasn't prepared.
I get you.
So it's all contributes to maternal mortality. So you see, when we go through all this, we tackle the delay in decision making. We should be decisive, and the delays at home, and then the ones at the hospital, we can bring all this together.
To work on those factors.
Yes, the factors that contribute to maternal and child.
And we will be happy. Before we go, we are about rounding up, but before we go, we want to delight it's the tradition of Ladyz Digest to delight our viewers, our audience, with a tip in one segment where we just give our audience a tip on what we've talked about. So we'll do that and we'll come back.
Okay.
Hello, welcome to Tips in One segment on Ladyz Digest. Let's talk about maternal mortality. From 2000 to 2017, the global maternal mortality rate declined by 38%, which is from 342 deaths to 211 deaths per 100,000 live births, according to the UN interagency estimates. This translates into an average annual rate of reduction by 2.9%. Some causes of maternal mortality are abortion, obstructed labor, and ectopic pregnancy. Always have access to good health care, embrace cleanliness and postpartum monitoring to prevent and reduce maternal mortality. Thanks for watching Tips in One. Enjoy the rest of the program.
Welcome back.
Thank you.
So before we want to round up now, what would be your last words, your advice for our viewers? What should they do for themselves? How can they help reduce this maternal mortality?
Thank you. So what I would say is that pregnancy is actually a beautiful time to enjoy, to be happy, to go through a process that your body may have not gone through before. Yes, it's a time it's an exciting time. It shouldn't be a time where some people get sick, but then some go through the physiological changes, some get sick and all that. But it's a time that we can make the best out of it. And if you prepare well for it, you get a better outcome of pregnancy, labor, and delivery. Yeah, so what I would say is that women should prepare for pregnancy. You can have a preconception care, doing antenatal. You should work together with your midwife, your doctor. You should cooperate with them. Yes, and then you should read more. I remember just
reading.
Last week I went to a woman. She had a very nice phone, but she had good internet and everything, but even how to look for information on Google.
Couldn't.
So we taught her, and then she was excited. I started typing how I can make my baby turn naturally and all that. So let us make it an exciting
So I think sensitization will equally help here. Sensitization.
Yes.
The campaign you mentioned.
Yes. Sensitization. Yes.
We should
it's
work
exactly
on that.
why we are on social media everywhere trying to
sensitize the women, at least in your own way.
Yes.
It was nice having you here.
Thank you.
And time is fast spent. I wish we could continue the discussion, but it was nice having you. And I know that when next we need you, you always make yourself available. Thank you again, Midwife Sally. Hey, this has been Ladyz Digest, and we had in our studio Midwife Sally, Sally Kodam. And she was here and we talked about maternal mortality. Remember to join our social media platforms and on Association of African Universities Facebook and YouTube pages, where you can go back and watch and follow the conversation. You can drop your comments there, you can drop your questions there, and they will be addressed. And remember to follow our Instagram page at Lady Digest. Till I come your way next time, I'm Joan Akua Iyoha. Do stay tuned.